in terms of when we're talking about sleep apnea, a lot of people have heard that term, and a lot of people kind of realize, hey, I've heard that's like when you're not breathing properly at night and you may be choking, you may be tired, etc. When you think about sleep during pregnancy, what are some of the common issues you see? And are there certain tip offs that a patient may actually be dealing with sleep apnea and be pregnant?
Yeah, so sleep apnea and some of the symptoms of sleep apnea are actually more common than you would think in the pregnant population. When we first started studying this over a decade ago now, we screened women for snoring and gasping and witnessed apnea, so where they stop breathing at night, and about a third of women actually snored loudly and more than 3 to 4 days a week, so frequently. So snoring is a common symptom of sleep apnea. It doesn't mean that every snorer meets criteria for sleep apnea, but snoring is quite common. And when it's happening and it's happening frequently, or someone can hear it from outside the room, that is something that is definitely worth bringing up to a an obstetric provider or a primary care provider, so that the person can get tested and treated and managed appropriately. And if someone tells a pregnant person that they're not breathing at night, or they have these pauses in their breathing, that's also not a normal thing that would happen. So I would say if you have any of these symptoms, definitely talk to someone about it. So breathing pauses, snoring excessively or loudly, uh, even being sleepy, like some sleepiness is normal in pregnancy early on, and later on in pregnancy, women get to be sleepy for various reasons, including hormones, etc. But if it's excessive, if you're having trouble driving, you feel like you're going to fall asleep if you're driving, or if waiting in a waiting room or something, these are not normal. Like, these are things that you definitely need to bring up to your provider.
Are there certain things that are happening physiologically that may tip someone? Do you have patients, for example, that maybe didn't have a lot of the symptoms of sleep apnea pre-pregnancy and then develop them later? Is there something intrinsic pathophysiologically going on, biologically going on, that leads the airway to be at more compromise during pregnancy? Can you speak to some of kind of the science behind that?
Yeah, so there are multiple factors that would hypothetically predispose someone to developing sleep apnea in pregnancy, or to having pre-existing sleep apnea potentially get worse in pregnancy. We all know pregnant women gain weight while during the course of the pregnancy, not so much early, but later on in most pregnancies. So weight gain is important. But more important than that is where the weight gain happens. So weight gain happens in the middle. So when that happens, it leads to the muscles that help you breathe being a little bit elevated. Your lung capacity becomes reduced, especially when you go back and you lay in a position. But pregnant women also gain fluid, like quite a bit of fluid during the course of pregnancy. And fluid can redistribute at night from like your legs and your hands and everything into the rest of your body, and might impact your upper airway as well. And then another thing is that protein levels in your blood, so we call it oncotic pressure, tend to go down in pregnancy. So that means that there's more shifts of fluid that may happen. So just like women feel like their hands are more swollen, they can't wear a ring because it doesn't fit anymore during pregnancy, similar things happen around their breathing tubes and their upper airway. And a lot of these things may predispose to the development of sleep apnea. We don't know in which populations one of these things is more important, but these are things that normally happen. Plus, there's also some nasal stuffiness that happens because of hormones as well, and that can impact how patent and open the airway is. So many of these factors contribute to it.